Senate Republican leaders unveiled their long-secret plan to repeal Obamacare on Thursday, giving GOP senators and the public the first glimpse at a bill that would rewrite the nation's health care system. GOP leaders still face huge hurdles in getting the bill passed next week, but the plan got a warm reception from Republicans after they were briefed Thursday morning. Senator John McCain, our era's, said the bill improves on Obamacare in about 100 ways and is also far better than the House-passed bill. It's a good beginning, he said. The status quo is unacceptable. The broad contours of the 142-page bill, which would tear down large parts of the 2010 health law, cap one of the nation's biggest entitlement programs and overhaul 1/6 of the U.S. economy, have come into focus in recent days. Majority Leader Mitch McConnell is pushing for a vote as early as next Thursday, ahead of Congress' July 4th recess and before more opposition can mount. But McConnell is still short the 50 votes he needs to pass the bill, with several senators saying they're withholding their support until they see final legislation. "I'm not that superficial to say I support or don't support a bill I haven't read," Senator Bob Corker said soon after the meeting, hinting that the draft proposal may need to change significantly in the coming days. "The draft we're looking at is not necessarily the draft that's going to be entered into the record." Since Senate Democrats are unified in their resistance, Republicans are using a fast-track process that can evade filibusters. But they can only afford 2 defections and still maintain the thin majority needed to pass the repeal bill. Senate Minority Leader Chuck Schumer and other Democrats immediately took to the floor to blast the plan. "The president said the Senate bill needed heart," he said. "The way this bill cuts health care is heartless. The president said the House bill was mean. The Senate bill may be meaner." When asked if the Senate plan has enough heart at a White House event Thursday, President Donald Trump replied, "A little negotiation, but it's going to be very good." The Congressional Budget Office hasn't yet weighed in on how many fewer Americans are likely to be insured under the Republican plan, or answered the crucial political question of whether premiums would be reduced. That report is expected by early next week, setting up a sprint to gather votes ahead of a potential late-week vote. The House bill, whose fundamental framework can be seen in the Senate plan, would leave 23 million fewer Americans insured over the next decade, according to CBO. The Senate bill, blandly dubbed the Better Care Reconciliation Act of 2017, eliminates Obamacare's mandates and hundreds of millions of dollars in taxes on the wealthy and the health industry. The bill also would phase out Obamacare's Medicaid expansion over 3 years beginning in 2021 and would impose significant cuts to the long-term Medicaid program. It keeps the structure of Obamacare's insurance subsidies to help low-income people buy insurance, but tweaks them to cover only those making up to 350% of the federal poverty line, down from the 400% covered under Obamacare. The bill bars the use of subsidies for plans that include abortion coverage, though some Republicans have said that the provision may not survive due to the Senate's strict procedural rules under reconciliation. Planned Parenthood would be defunded for 1 year. Senate Republicans would allow states to opt out of some of Obamacare's insurance requirements, including one requiring states to have an exchange, as well as rules for what benefits insurers must cover, what qualifies as a health plan, and the actuarial value of the plans. The bill won't allow states to waive Obamacare requirements that insurers accept everyone and charge the same rates, with few exceptions. The House waived the latter requirement, triggering a storm of criticism that it was abandoning people with pre-existing conditions. Republicans are hoping for broader buy-in from the healthcare industry Thursday than the House bill received, some senators said. But the bill's fate will rest on how factions on either end of the conference's ideological spectrum react to the bill's sweeping proposals. Indeed, conservatives, moderates and senators from Medicaid expansion states all remained on the fence even after coming out of the meeting. "By the time I get back to my office I'm told I'll have a copy," said Senator Lisa Murkowski, of Alaska, a key moderate swing vote. "There was no paper. I want to get back to my office and actually take a look at it." along with other Medicaid expansion state senators, like Ohio's Rob Portman and West Virginia's Shelley Moore Capito. Murkowski is worried about the consequences of cutting off Obamacare's enhanced funding so quickly, and pushed instead for rolling back expansion over as many as 7 years. Murkowski and Senator Susan Collins have also warned against defunding Planned Parenthood as part of the bill, and expressed reservations about the impact certain provisions may have on elderly Americans' ability to afford coverage. And among conservatives, there remain serious concerns over whether the repeal bill amounts to a true repeal of Obamacare and the regulations it imposes on the health care system. Senator Rand Paul said that he and other senators, he declined to name them, would have a statement this afternoon on the bill. The Kentucky Republican refused to share details but said the bill doesn't repeal enough of Obamacare. Senator Ted Cruz is pushing for an amendment to allow catastrophic, low-premium plans, but it's not clear if the parliamentarian will allow them, according to Republicans. Senate Republican leaders have spent the last few weeks trying to manage that delicate ideological balance, in hopes of charting a narrow path to 50 votes. Still, Republicans said Thursday's all-conference meeting demonstrated there are still a number of issues yet to be solved. It's obviously a discussion draft, said Senator John Thune, R.S.D. So we've got members who are going to be interested in looking at the text and see what they can do to refine, improve and dial things accordingly to try to figure out how we get 50 votes. Quotation mark.